Hello, everyone. My name is Dr. Ebony Drummond, and I am the Senior Manager of Health Communications here at Expecting Health. And I want to welcome everyone to our first event of the year entitled Join in Work Groups and Opportunities for 2023. So just to give everyone an overview of what you can expect during this webinar, I'm going to go over the webinar logistics, and then we are going to have several of our team members discuss different work groups and initiatives that they're a part of, and then we'll have our Q&A session. So as you probably just heard, the webinar is being recorded. And if you have any questions during the presentation, please feel free to put those in our chat box so that way we can make sure they are addressed during our Q&A session. All right, and with that, we will go ahead and get started. Just want to introduce Natasha Bunham. She is the founder of Expecting Health and director of Baby's First Test, and she is going to give us more information about our CMV Work Group Connect.
Great. Thank you so much, Dr. Ebony. Hello, everyone, and thank you so much for joining. We really thought about having this webinar because so often we may mention something and someone says, oh, I had no idea you did that, or I wish I could get involved. So that's why we're here. And so we're really excited to have you. And I am really happy to speak about our Connect work group. And the purpose of it is really to address the hard questions about the integration of CCMV into newborn screening programs across the US. This is something that I would sometimes have state partners come to me and say, gosh, we know there's a movement around this, but we don't really know how we're going to implement this. And then we would have our partners in advocacy and awareness building come and say, we really are ready to do this, but we don't necessarily know exactly who to talk to. So we really thought this would be a great opportunity to bring people together and have them work together. Next slide, please. And we really see our Connect work group, this first one that we're doing is around CCMV, but it really being a model for how we can facilitate conversation and really relationship building between different interested parties around a particular topic. In this case, around integration of a new condition into newborn screening. So who's involved? You could probably use this list for almost all of our work groups because we really like to be very inclusive. But on this group, we have parents, we have state newborn screening laboratories, we have state follow-up programs, we have people who are part of CCMV as well as EDDI follow-up programs or EDDI programs. We have some industry representatives, health providers, professional organizations, advocacy organizations, and researchers. And that may seem like, oh, that's a lot to parse out. But for each of these, I would say there are minimum 2 different types of experiences and perspectives. And this is why it's so important for us to bring people together and to really hear about the experiences, the challenges, and the opportunities from all these different lenses. Next slide, please. So what have we accomplished? We had, I wonder if these might not be the slides I sent in, but that's okay. We had a couple of meetings last year, really to kick things off and to start the education and awareness building process. We were so lucky to have our partners from the National CMV Foundation present from both the patient perspective and the family perspective, but also how things were going from an implementation piece and to really think about, not just what have families experienced, but as the leading organization on this topic, really what they were envisioning for the next couple of months through couple of years around the integration of CCMV into newborn screening. We also had amazing presentations from the Minnesota Department of Health, as well as from Utah's program, to really talk about their experience of doing the early identification and trying to set up a program around screening. And this really gave the opportunity for people who maybe aren't in the day-to-day implementation phase of CCMV to ask questions to really get a better sense of what were the challenges, and then together really think about what are the different types of solutions we need. We know in this type of work, we need both the scientific solutions and implementation from a lab and program perspective, but there are also policy solutions that need to be put in place, broader advocacy solutions that need to be thought about and fleshed out, as well as then the education for families and for providers. So it really gave a great opportunity for people to speak to each other and really learn from each other. Next slide, please. So to continue with that, the work group really facilitated those discussions. The way the work group was structured is that it was an hour and a half, and no more than 45 minutes of that was spent on presentation, so that we really could dive into the conversation. And it doesn't mean that there's always an answer, right? When you're starting a program or you're starting an initiative, a lot of times the key issue is really to lay out, oh, what are all the tricky spots? Where are the gaps? What are the things that we may think are set, but then when you actually ask the invested party, they say, oh, no, we don't have those guidelines yet, or we don't have a starting off point. And so for everyone to kind of come together, really identify what was needed, and to think of who are the other partners that need to be brought into that conversation. Next slide, please. So where do we go from here? We will be starting the meetings again in early spring. We're going to focus on a couple of key areas, particularly around what is needed for implementation. So really looking at what are the technology opportunities, policy approaches, what families need for support, both during this time of implementation. So not everyone is going to be getting that screening, all the way through what will it look like if there are bigger parts of the population that do get screened. What do clinical networks look like? And it's really important. This is a lot, and we do not think we, through this work group, are going to do all of this. Not at all. We know that there are other initiatives out there, which is great. It really is kind of to sketch out the map of what is needed, and also what other partners may be able to do, pull into their work. And so we really are also really looking forward to the different subgroups that we will be able to create from this, potentially in partnership with other groups. Again, we're not trying to own all of this work. We really were just trying to get these conversations going, and to really help people kick off conversations with people they maybe hadn't spoken to before, but really needed to if they were trying to move forward with their vision of implementation, because that's really what's at the core of this model. I think that's my last slide. Oh, of course, this one. If you have any questions or interested in getting more information, please feel free to reach out to me. Thanks.
Thank you. And next up, we have Mariana Rea, who is the Associate Director of Programs for Expecting Health, and she is going to give us some more information about the Newborn Screening Education and Communications Work Group.
Thank you so much, Dr. Ebony, and thanks to Natasha for that great overview. As she mentioned, I think you'll probably see some similarities in what I share with you about this specific work group and the strategies that we're implementing, but wanted to just highlight as well that, excuse me, that what we're sharing really does speak to kind of the intentionality and the specificity that we often think about at Expecting Health when we're really thinking through the use and the purpose of work groups. And we know that there are lots of them, and we know that most of you listening in are a part of different work groups in a variety of different ways. So just to echo Natasha's comments as well, that really our hope in sharing this with you is to share not only a bit more about some of our strategies and priorities for this coming year, but really to emphasize the various different ways that work groups can be useful, and kind of some of our thoughts behind how we're setting those up. So I am going to stay within the world of newborn screening for just a moment, but I promise you that that is just one slice of what we do at Expecting Health. And for those of you that we work with closely, you know that through a number of our other programs, we really expand beyond newborn screening as well. But I'm going to take us out just a little bit to a bit of a larger lens of newborn screening and speak to you about the work that we're doing through really that initiated through one of our newborn screening programs, but it really encompasses a variety. So next slide, please. The Newborn Screening Education and Communications Work Group really launched through some initial pilot work that we were able to conduct through the Newborn Screening Family Education Program, which is one of our HRSA-funded grants that we have received. This is a 5-year grant, and we're actually in our last and final year of this grant, which is hard to believe. And just want to acknowledge and thank our partners at HRSA. Next slide, please. So earlier in prior years of this work, we were able to conduct some initial work to really try to understand and investigate education around newborn screening during pregnancy. And I think, many of you listening in on this call are aware that for a lot of families, when they first learn about newborn screening, it's not during pregnancy. It's typically after newborn screening has happened. In many instances, it may be when a family is receiving a phone call about an abnormal or an out-of-range newborn screening result. And through the Newborn Screening Family Education Program, really the core goal of that program was to think about ways that we can improve education and create different opportunities for families to learn about newborn screening really throughout the process of newborn screening. And so we took that to heart and really thought about, okay, if we want to improve and change how families are becoming aware of and learning about newborn screening, we really want to focus on prenatal education. And so through some pilot programs that we were able to launch in years 3 and 4 of this program, we learned that by introducing an educational initiative during the 3rd trimester of pregnancy, we really were able to increase an individual family's awareness of newborn screening, their knowledge of what to ask their providers, and their overall just confidence about the expectations of newborn screening. So in an effort to continue that work and to really think about how do we bring those pilot programs and the lessons that we learned from those pilot programs to a larger group of newborn screening stakeholders, we convened a group of newborn screening stakeholders through this Newborn Screening Education and Communication Work Group. And really the goal was to develop a tool to sort of bring together these experts to share this experience and the lessons learned, and to really develop a tool that we can then share with other state newborn screening programs to help them implement parent-centered newborn screening education. And again, we recognize that many states are already doing work around education and communication, but really just honing in on that and creating specific tools that can expedite and help facilitate that work. Next slide, please. So as Natasha said, you will see some similarities. And again, just to emphasize that when we convene work groups and task force and other groups, we really do spend a lot of time in the planning phases to think thoughtfully about who needs to be involved. And we really aim to include as many different perspectives and experiences in these groups. So for this particular work group, we really wanted to bring a variety of different representatives from state laboratories. And I say laboratories, but also follow-up programs as well. So really thinking of the entire newborn screening program at the state level, and including different representatives from medical directors and chiefs of the branch to follow-up coordinators to educators and to all other aspects that might be involved. And we also really wanted to stress the importance of including parents and families as individuals who experience receiving the results and experience receiving education and communication. We really wanted it to be, an all-encompassing perspective. We also, through the Newborn Screening Family Education Program, also have facilitated and convened a group of family leaders who have gone through some extensive training to become newborn screening or navigate newborn screening ambassadors. And so in addition to parents and families from the community, we've also included several of our newborn screening ambassadors in this work group. And we also partner often in much of our newborn screening work with the National Center for Hearing Assessment and Management, who also brings a very unique perspective on quality improvement work and expertise in that area. So as we're thinking about developing this implementation tool, testing it and revising it, we really wanted to have partners who would help us, again, kind of think about that strategically. And through this group, we have representation from 12 unique different states. So really excited to have kind of depth and breadth and experiences with this group. Next slide, please. So what have we done? So this group initially launched in October last fall of 2022, and we've actually been able to convene on 2 different occasions. And so in the first call, or in the first meeting rather, we really had a time of networking and meeting one another, which is truly an important part of these work groups. Not only do we learn from one another, but I have found that it is a great opportunity to connect and to learn about what others are doing. So we were able to, in our first call, really lay out the expectations and the scope. It is, you'll see in just a moment, our goal to develop this tool is on a rather tight timeline. So we wanted to be as specific as possible early on to set expectations for what we're hoping to accomplish, and spent quite a bit of time laying that out in that first call. And then in our second call, and in between, we really asked we asked the work group members to take some time to think about other implementation tools or other resources that they've leveraged in their own states or in other work that they've been doing, to help us think about what has worked well, what would be helpful in terms of an implementation tool. What does that look like? How has that been used? And as Natasha mentioned in the work group, in the Connect work group, similarly, just really leaning in on each other to learn more about what works best and what are things that have been barriers in the past that we need to be thoughtful about and try to put things in place to overcome as we build this tool. We are currently in the process now of taking that knowledge that we've gained and that sort of expectation setting from early on to start to clearly define the different domains of implementation, starting from relationship development to really thinking about what materials need to be reviewed and tweaked, but really starting to define what the steps to implement this prenatal education initiative at the state level. And it's been really fun to start to think about from state to state, what are the similarities in implementation and really what are the unique pieces that states are having to think about. So we look forward to really kind of developing that a bit more and shaping that to be able to share. Next slide, please. So what do we have planned? Again, as I mentioned earlier, we are trying to tackle and develop this tool on a pretty quick timeline. So we've met twice, and we are planning to meet 4 to 5 additional times through June, really with that end goal of creating a tool that we can then share with other state programs to really help them think about and implement prenatal education within their state. So we are working directly, as I mentioned, with a number of different states who are already in various different phases of helping not only shape this tool, but also of piloting the use of this tool. And so over the course of the next 6 months, we really hope to further define the tool, test it out, revise it. And our goal is to have something that is ready and shareable by the summer of this year, aiming for July. So we look forward to being able to share that tool with all of you and others once it is available. And we really hope that this will be beneficial to really thinking about expanding awareness and education of newborn screening during pregnancy. I think that wraps it up for me as well. And of course, and we'll have time for questions and comments as we finish up the presentations, but we're always interested in connecting. So if this is something that you want to learn more about or are interested in, please don't hesitate to reach out to me directly. This is my email. Thanks.
Thank you, Mariana. All right. And last but certainly not least, we have Bailey Prochet, who is the Community Engagement Manager for the National Genetics Education and Family Support Center, also lovingly called the Family Center, here at Expecting Health. And she is going to give us more information about the Family Center Work Group on Inclusion and Community of Practice on Diversity, Equity, and Inclusion.
Thank you, Dr. Ebony, and thank you, Mariana and Natasha. So like Dr. Ebony said, I am the Community Engagement Manager for the Family Center. And today I'm going to be talking about our 2 work groups. So next slide. So similar to the Newborn Screening, Education, and Communication Work Group, the Family Center is funded by HRSA. So we did want to take a minute to just highlight their support and thank them. Next slide. So the Family Center Work Group on Inclusion is tasked with asking the hard questions and having difficult conversations to identify inequities and barriers to inclusion so that we can address them and achieve a more inclusive and vibrant community. So the way we do this, or the work group's role, is to ultimately support the Family Center in ensuring strong family professional partnerships, and that families are central to genetic healthcare delivery systems around the nation and U.S. territories through the development of products, resources, and trainings. Next slide. So who's involved? Similar to the other 2 work groups is we have family leaders involved. We try and stay between 8 to 10 family representatives from around the United States and the U.S. territories. We try and keep it small just so that way the work group is conducive and we're able to get things done. But in addition to our members, whenever we're developing they are developing products, they do work a lot with clinicians, the newborn screening ambassadors, and other partnering organizations. So for this work group, members are compensated for their participation, but as such, they do have certain responsibilities, such as meeting once a month. It's typically on the 3rd Monday of the month in the afternoon. And during these meetings, they work on creating resources and products that are generated from the needs discussed by work group members. They also create and deliver at least 2 webinars annually, and we try to get them to host regional genetics network office hours. And then when requested, they do also review and provide input on different Family Center projects and activities. Next slide. So accomplishments. This past year, our work group was able to complete a questions to ask your genetics professional document. It is in final review and we're hoping to get that out in the next couple months. Next slide. But for 2023 our work group is planning on doing some really great webinars. They have 3 different topics identified and they will be completed this year. Our goal is to have them all done by May. And so the topics will include family engagement, implicit bias, and effective communication and support between patients and healthcare professionals. So definitely be on the lookout for those webinar invites because they will be interesting. Next slide. So how to get involved. Like I had said earlier, we try and keep the work groups small. So for this one, there is an application needed, but don't let that scare you. Please reach out to either myself or Molly Martsky. She is the program director for the Family Center. And email us and we can walk you through it and tell you more information about the work group and how you can get involved. Next slide. So the next work group that we have is the Community of Practice on Diversity, Equity, and Inclusion. We lovingly call it Community of Practice. And So this work group was formed basically because we had so many people interested in doing the work group on inclusion. We didn't want to say no to people, so instead we created a sub work group to talk about very similar topics, but on a more relaxed basis. So the purpose of this work group is to facilitate the involvement and connection of individuals and stakeholders in the genetics healthcare delivery system, and to effectively address the complex challenges that families face as they navigate the genetics healthcare delivery system. Next slide. So similar to the other work group, those involved are family leaders, clinicians, newborn screening ambassadors, and partner organizations. Like I said, we try and include everyone if they're interested in genetics or family leadership. They are absolutely welcome to join. Next slide. So accomplishments. Thus far, the Community of Practice Work Group has read and discussed several articles on diversity, equity, and inclusion. A few examples of the type of articles that are discussed is one that we recently did was ending patient volunteerism, how patients can be compensated. And another one was employment helps adults with intellectual disabilities see what they're capable of. Our members really loved both of these articles, and it brought up really great conversation. So those, again, are just examples of some of the articles we read. And in addition to having the rich discussions on these topics, the work group has also begun exploring how to implement systems change in each group's members' sphere of influence. Next slide. So plans for 2023. We plan to continue reading more amazing articles and having really rich discussions and continuing to learn and grow together, and trying to determine how those group members can implement systems change in their own sphere. Next slide. And finally, how to get involved for this work group. If you are interested in joining, please email us and we can send you the link to the meeting invite. Like I had said before, this group is very relaxed. So we'll send out the article about a week or so before the meeting so everyone can read it. If you're interested in it, please join. There, it happens sometimes you're just not interested in the article, and that's totally okay. Sometimes we won't have members join, and then we have new members who are super interested, who got the article from a friend, who will join. So it's very relaxed, and we're very interested in having anybody come.
Thank you, Bailey. All right, everyone. So those are just a few of the work groups and initiatives that we currently have going on at Expecting Health and our different programs right now. So now we will go into our Q&A session. I'm looking in the chat. I don't see any questions there, but I do have a few questions for our team members here. So the first question is, how have work groups helped support Expecting Health in achieving organizational goals?
I'm happy to kick that off. A key tenet, you could say, of Expecting Health is really convening. And we think that's so important because so often it's really easy to get kind of stuck in your silo and talk to people who have had very similar experiences as you. But we all know that we learn so much when we talk to different people who have had different experiences and bring different skill sets to the table. And I think it's clear through even just the subset of work that we presented today that that type of bringing people together and collaborating is done and is really, really generative. You know, I think of some of the work groups that we've started in the past, and even our Connect work group, people kind of coming in and saying, okay, what is this about? Are you going to preach to me about needing to include CCMV, or are you going to tell me all the challenges? And is that all we're going to work on or speak about? And it's really, no, we're really actually just going to talk. Sometimes the beginning of the relationship is a conversation and is just to hear different perspectives and to be able to ask questions that sometimes you may not feel like you really know someone well enough to ask, but we really try to have our work groups be a place that's very inclusive and we have respectful discussion. And sometimes it can be hard, right? You hear someone say, you should be doing XYZ. And they may not mean you individually. They may mean, just what the system should be doing or could be doing better. But it's through those tougher conversations that I really believe we're able to move things forward and make sure that there is actually better health and health outcomes for the communities that we serve. So that's a very long answer, I know, but that really is how these work groups help us achieve not just the goals and objectives of our programs that we get from, our work plans and from the reports we write, but really at the core of who expecting health is, and really getting to that level through relationship building and having those tough conversations. See if anyone else wants to add to that.
I think you said that so well, Natasha. We have oftentimes conversation internally, and as I listen into what others have shared today and kind of reflect on how that relates to work that we're trying to accomplish, I often think of work groups and the outputs of those work groups in three very specific things. And even in Natasha's answer, like I'm hearing that in what you just said, which is great. And the first is connecting. So I think such a huge part of any work group, whether it's through Expecting Health or otherwise, is just connecting to others and being able to build those relationships. So much of systems change and making change is dependent on relationship and partnership. And the first step in really getting a great relationship is to connect. And so just simply providing a place where making a connection is easy has been so empowering to the work that we're doing, but also supporting others in the work that they're doing as well. The second thing that always comes to my mind too is sharing. I mean, and as Natasha said, it's a very respectful and safe place to share. And that's not always the case in some of work related to public health or some of the areas that we're focusing in on. And so just really having a safe and comfortable environment to share experiences, no matter what that experience might be. And then the last thing that's probably most important to how we're accomplishing what it is that I personally feel like our work groups really do build. They, as Natasha said, we iterate on things, and truly the work and the output of a lot of these groups is something that is tangible and that can be shared within the communities that we're all a part of. And that is, I think to us, the most valuable thing is that we're not just convening just to talk, though that's part of it, but that there is an end goal in mind and something that is created that really will support or change the systems that we're working within.
Great, thank you. And not sure if this has been experienced, but how do you all help prevent burnout for the work group participants?
I can start. I think that's a great question. I think there are probably many of us on this call who can look at our calendars someday and say, wait, when am I supposed to do the work? Because I'm on a work group or in a meeting every single hour. And so we take that very seriously. So we do not assume that a work group we would create would meet every month. We really think about that. So for example, the Connect work group is really on a quarterly basis. We also can, depending on how the work group is structured and what the outputs are, sometimes people trade off from an organization in terms of who's going to be there. And as long as we know that and that fits with kind of the topics that are being discussed, we're completely open to that. We also do different types of assessments and surveys to kind of see how things are going. We do that for our steering committee meetings for our projects to really get feedback Are they getting information more frequently enough from us? Does it feel like it's too much? Does it feel like it's really relevant and engaging? We don't want to have work groups just to be able to say we have a work group and then to get on the line and then no one really say anything, right? And we've all been there. And sometimes, you think you have a great idea and it's not quite the hit, but then we really get feedback to say, well, what would make this useful? Like, why are you getting on this call besides just, oh, I feel like I have to? We want when people leave our work groups or them a work group session to really feel like they got something out of it. And again, that could be very kind of traditional in terms of training and knowledge transfer, but it also can be, and what we really want it to be is really feeling like you're building relationships and you're getting to know people in a way that you wouldn't otherwise. But it's also, we have plenty of people who say, I need to take a break. And we really encourage people to say, just be, let us know where you're at and you can always come back and join in, or if you have someone else that you think would be a better fit. So those are some of the ways that we try to address burnout or just that fatigue of having so many meetings and having your camera on all the time, right?
Agreed. And exactly what Natasha said. And then also like what we do with community practice is try and make it fun. Is obviously there are definitely times where we have to have the serious conversations or have to sit down and like, okay, we need to get X, Y, and Z done. But for community practice is really trying to choose an article that our members will really enjoy or will create conversation, and also reaching out to our members and saying like, hey, what articles or what topics do you think are important right now? What would you like to talk about? And so really having the members involved and planning the meetings is helpful as well.
Yeah, I completely agree with all of those comments. And the only other thing I would add too, I mentioned this earlier, but I do think sort of having a clear end goal, at least for a particular project, is also helpful. I think I can speak for myself when I'm a part of groups where I can be confident that what I'm bringing to the table is useful and that it is creating something valuable and meaningful, then I'm typically more engaged. And I think we see that not just in these 3 work groups that we've spoken about, but in other, work that we've done and that we've done with you all as well. So just really being clear about, this is our goal and how are we doing towards that goal within this group, and speaking to that, periodically when meeting has been really helpful. Would love to hear from you all too. I don't know if you've seen it in the chat box, but feel free to chime in there or unmute yourself and chime in as well. If there are things that have been helpful to you, we'd love to hear that.
And while we're waiting for people to hopefully chime in, I do have one more question, but I will go ahead and go to our expecting health slide so you can see other ways that you can stay connected with us. And feel free to, oh, wait, we have a hand. Go ahead, Dion.
Go ahead. No. I raised my hand because you were going through your recap of how you can stay connected to expecting health.
So, okay, one last question, unless we get more in the chat. And Mariana, you kind of hinted at this, so it's great. It's a great segue. Where do you all see the work going, or how do you see it evolving over the next 3 to 5 years?
I didn't put my hand up again, but to go back to Mariana's question about what makes, let me get it exactly right, helps us stay engaged.
Oh, yes, please.
It's really helpful to not necessarily have an agenda, but to know what you're meeting for, because sometimes a meeting could have been an email. And for us to be able to share perspectives and that are listened to, because it seems like I'm a part of a lot of different work groups, and I volunteered for them all, and I get something from each one of them. But sometimes what I'm finding is, depending on the subject matter, something could have been just for example, we were called, an emergency meeting was called because of some things that happened on the Hill, right? But when we got together, nobody talked about what the subject was in the email that was supposed to get us together. And so, if you are busy and you take time to schedule something, it should be as effective and enriching, which is the same, which feeds into the work that we do. And so if we can kind of, not like from 12:30 to 12:37, we're going to talk about this, but just like, we're going to get on the call and we're going to see whatever is in the community that you feel that an agenda with a call to action, right? And also the second thing is the things that have helped me stay engaged is things that I'm passionate about, that are when we give suggestions, or in my last call, we were taking ideas, making sure that the ideas that are given and taken are acted upon, and not just for the sake of, we want to hear what you say, but we really don't want to do what you said. So that's my spiel.
No, thank you so much for that information. That's very helpful as we move forward with our work groups and initiatives, and in creating future work groups and initiatives. So it's great to get that feedback. Thank you.
Yeah, and I think that's a really good kind of, I think sometimes when you are the person pulling together the work group, you can feel like you're being really repetitive. And I think that's a really great reminder that those are all anchor points that are really helpful, right? Whether that's putting in the email exactly kind of what you're going to talk about, or at least the bullet points, and then at the head of the meeting to kind of lay that out. I think all of that can be really helpful, because we, like you said, we're all so busy and pulled in lots of different directions. And then to kind of go back and to say, oh, did that meeting go, or that call go the way we thought it would? If it didn't, is that a good thing? Are there things we can learn from that? So I think that's really great, and appreciate your feedback at that level.
And in addition to that, Tawana Williams in the chat said, I think building relationships also helps people to stay engaged. So let's see. Another question we have for our team members here. Do you only do work groups that are connected to your federal funding programs? Or federal, or programs that have been established with federal funding, excuse me.
I can jump in. So Connect is actually not funded through any of our federal programs. It is separate from that, and it falls under our Baby's First Test work. And so the short answer to that is no. We are always looking for different opportunities to work with different people. So again, like Connect is a great example of people saying, it'd be really great to learn from other people. And so we just kind of saw the need and worked to get that done. So we are happy to work outside of the federal programs that many of you know about already, to, work with people, work with different groups, help be a facilitator, be an extra pair of hands, as they say, if there's a topic that really is aligned with our work and we know can be supportive and is needed in the community.
I was going to add in as well with the newborn screening education and communication work group. While kind of the initial work was done through one of our federally funded grants, this ties into the question of where do we see this work going in the next 3 to 5 years. Part of the reason that we were very intentional about thinking about the group as both experts in pulling together information to support education, but also communication. Part of that is because we see how much the newborn screening community is evolving. And in the next 3 to 5 years, there are a lot of other issues that we anticipate will need support and expertise and work, particularly around that communication piece as well. There's a lot of new conditions that are either being added or under review. There are changes that we anticipate overall to newborn screening. And so having this group established will certainly be beneficial and helpful as we start to tackle, as a community, some of those upcoming topics and issues. They're not necessarily all barriers, but certainly as we think about how the newborn screening landscape may evolve over the next 3 to 5 years, having a group like this already established and growing will certainly be helpful.
Thank you all so much. So in the chat, someone said that they agree with Tawana. Linda agrees with Tawana. The ability to network a bit and have some allowance for honoring a milestone moment someone might share builds trust and authentic relationship, which helps as we work together on a project. Bailey and Molly from the Family Center do a nice job of this. All right, so I have one more question, unless we get some more in the chat. Well, actually, no, I think that was my last question. So unless any of our Rockstar initiative and work group leaders want to leave with a comment or one last thought.
I'll
No,
leave with
you
a
don't
thank.
have
I'll leave with a thank you. We recognize a lot of the names and people who have shared your time this afternoon with us. We realize that for many of you, you're a part of these groups, or you have been a part of other work groups. And so, thank you for being willing to partner with us and help us accomplish this. So we appreciate you.
Yes, exactly like what Mariana said, is thank you everyone for joining today. We know it's lunchtime, or well, lunchish time on a Thursday, and we appreciate that. But also thank you to all of our members who join every month and those who are interested in joining. We look forward to hearing from you.
Yep, I echo what's been said. We really can't do this work without you all. Even if you can't join all of the calls or all the work groups, but even just, a conversation can plant a seed that grows into an idea and grows into, an opportunity for people to get together. So thank you so much. And thank you for joining us today.
Yes, thank you everyone so much for being with us today, and we will see you next time.